Well, hello, assalamu alaikum wa rahmatullahi wa barakatuh. Good evening, ladies and gentlemen. Welcome to this informative Zoom webinar titled Interview A Complete Guidance. This is Abdul Malik Al-Hadloul, a medical student at King Faisal University, and I'm thrilled to have you all join us today. In the dynamic world of healthcare, mastering the art of interviews is a crucial skill for both seasoned professionals and those beginning their journey in medicine. Today, we are honored to have two distinguished guests with us, experts in the field of plastic surgery, who will provide invaluable insight into the intercase of interviews. Our first guest is Dr. Fahd Al-Jindan, a consultant plastic surgery and residency program director at Mecca Health Cluster, where he contributes to the development of future plastic surgeons in the region. Dr. Al-Jindan holds a degree from the Saudi Board of Plastic Surgery and has further refined his skills through two notable fellowships. The first in reconstructive microsurgery was completed at Changjiang Memorial Hospital in Taiwan. The second fellowship, focusing on hand and microsurgery, took place at the respected Kristen Kleinert Institute in Kentucky. In addition to his clinical work, Dr. Al-Jindan has been actively involved in academic research. He has contributed to book chapters and published articles in peer-reviewed journals, demonstrating his commitment on ongoing learning and development within the field of plastic surgery, bringing years of experience and expertise in guiding medical professionals through the interview process. He will share his wealth of knowledge on what makes a successful interview and offer tips for aspiring candidates. Joining Dr. Al-Jindan is Dr. Taif Njedi, a plastic and reconstructive surgery resident at King Fahd Medical City, second cluster in Riyadh, Saudi Arabia. A graduate of Imam Muhammad ibn Saud Islamic University. Dr. Njedi will share personal insight, challenges faced during interviews, and advice for residents and young professionals aspiring to excel in their medical careers. Whether you are a seasoned professional looking for refine your interview skills or an intern preparing for your next big opportunity, this webinar is designed to provide a comprehensive guide to interviews in the medical field. Let's delve into the world interviews with our esteemed guest, Dr. Fahd Al-Jindan and Dr. Taif Njedi. Welcome.
Thank you, Dr. Abdul Malik, for this introduction. I'm honored to be here with you today, and hopefully that I will give you some of my knowledge and experience in dealing with interviews and difficult interview situation and questions. Can I start?
Yeah, sure.
Okay. So today I will give you a brief technique or a maneuver that will make your life easier when going for an interview. So before we start, I want to ask you all, what are interviews? ايش المقصود بالinterviews؟ طبعا الinterview is a formal conversation between the residency program's representatives and the candidate. مين هم الريزيدنسي بروجرام ده الريبريزنتيفز اللي هم قائمين على البرنامج البروجرام دايركتورز اللي هم الار تي بيز ومثلا الريجنال بروجرام دايركتور هدول هم اللي نعتبرهم ريبريزنتيفز والكانديديت طبعا هو الانترن او الريزيدنت اللي being interviewed. It's an opportunity for both parties to assess compatibility, interest, and potential for success within the program. كثير مننا يفهم انه الانترفيو is merely انه for the resident، بس هو في المقابل it's not like that، يعني it's both ways. الشخص حتى انت كcandidate انت قاعد تقيم الاشخاص اللي بيسووا لك انترفيو، بتشوف هل البرنامج هذا مناسب لك ولا لا. ف it goes both ways. It's not just from one end. The purpose of the interviews from the program perspective is to evaluate the candidates beyond their application materials. This includes assessing interpersonal skills, professionalism, clinical reasoning, and motivations for joining the specialty and the program. لأنه إحنا لما نشوف الأوراق, when we get your CVs, we're evaluating you, the initial evaluation based on the CV or reference for recommendations. And this is not enough. And this is the purpose of interviewing you guys, or those who are applying for the program, is to evaluate you in person. يعني مو كل شيء نقدر نحصله من الCV. A lot of information, valuable information, نقدر بس we can يعني conclude final result من personal interview. And from the candidate's perspective, the interview is there for them to present themselves as well-rounded individuals, showcasing their personality, يعني تعرضوا شخصياتكم, لأنه هذا مو كله مبين في الورق. Communication skills, professional aspirations, and it's also a chance for candidates to learn about the program's culture, faculty, and current residents. فهذه هنا تكمن أهمية الانترفيو، إنه sometimes يمكن تشوف الريزيدنت أو الابليكانت سواء resident, intern, whatsoever, تشوف والله ممتاز على الورق، بس لما أجي أقابله أحس إنه في عنده issues. He's not مثلا motivated, he's not professional, مثلا ما عنده good clinical sense. والعكس صحيح، ممكن بالعكس يبين في السي في انه هو is average ولا ما هو is not suitable، وبعدين لما تشوفه في الحقيقة تغير فكرتك تماما، لانه لاحظت انه لا، في الاوراق ظلمته، هو احسن بكذا من بكثير، بس ممكن ما قدر يوصل لنا كثير من الاشياء من خلال السي في او recommendation letters. فهذه هي اهمية الانترفيو، انا اشوفها اهم من اي شيء اخر. الكومبوننتس للانترفيو، في عندنا personal interaction اللي هو face-to-face meetings with the faculty, residents and the program directors. ممكن تكون ببعض البروجرام زي الفellowships. أنا الفellowships زي اللي سويتها مثلا خاصة abroad زي في USA، كان عندنا tours في الهوسبيتال. الانترفيو goes on for 2 days. ويصير في informal gatherings، مثل نطلع لمطعم عشاء، وكمان يجوا يحضروا الاو ار، الابليكانتس، الكلينكس اللي يمروا لازم على كل شيء just to provide a glimpse into daily life at the program. كأنه أنت في وسط المعمعة بتشوف كيف البروجرام من ناحية الكلينيك، الاو ار، يعني just to have a brief idea. فهذه هي البروجرام interviews. هذه جزء من، أنا أحسها integral part، إن شاء الله تصير عندنا برضو قريبا. طبعا بالنسبة للإيفالويشن، في formal evaluation اللي هو عبارة عن structured interview questions، وفي informal throughout the interactions. خصوصا هذه اللي بتصير في التورز أو informal gatherings، ممكن تلاقي ال representatives حقون البروجرام they can assist you informally through the interaction throughout the day, and based on that they give their assessments. So the goal is to find the best match between a program's offerings and the candidate's career goals. يعني ما هو بس احنا اللي نبغى نختار، انت كمان كcandidate you want to choose, you want to decide whether we're suitable for you or not. So it's both ways. How to prepare for the interview. الحين جاكم مثلا ما شاء الله يعني جات السي في ووصلت وقالوا هذول الخمسة they're suitable match for the interview. كيف نبدأ نجهز للانترفيو؟ كلموا قالوا لك يا محمد ولا يا سارة you are congratulations، حتجي لك انترفيو. كيف حتحضروا الانترفيو؟ Number 1 research. ما أقصد بالريسيرش اللي هو البحوث. We want to research about the program specifics, understand the program's mission, values, culture, know the curriculum, research the opportunities and unique aspects of the program. هذه very important. يعني ما تدخلوا للبروجرام او تقدموا على الانترفيو واحنا ما احنا عارفين اي شيء عن البروجرام. لازم نكون سالنا عن البروجرام، قرينا عن الكوريكولم، ايش الاشياء، ايش الويكنسز، ايش مواطن الضعف في البروجرام، ونجي للانترفيو واحنا جاهزين. بالنسبه كمان للانترفيورز if possible you need to find out who will be interviewing you, learn about their roles within the department, and if there are any recent publications or projects that they may be involved with. هذه بتعطي impression very good impression لما توري الفاكولتي انك مهتم. You did your homework, you did your part, you researched them, you researched the program, وبعدين جيت for the interview. Self reflection. ايش معنى self reflection؟ لازم اي شيء نحطه في السي في نكون فاهمينه. ما يعني مو بس كذا نكتب السي في او نخلي تشات جي بي تي يكتب لنا السي في ونجي واحنا ما احنا عارفين اصلا ايش في السي في حقنا. You have to be intimately familiar with everything on your CV, including research, work experience, volunteer work, and educational background. لأنه أي شيء ممكن تنسأل عنه. وإذا انسألت عن شيء مكتوب في السي في and you couldn't answer it, يعني you will look bad in front of everyone. You will lose credibility. So that's why you have to do your homework, do your part. Your goals. You should be able to articulate your career aspirations and how the program aligns with your goals. Your questions, prepare thoughtful questions that demonstrate your interest in the program and that you have done your homework. يعني دائما احنا في اخر الانترفيو نحب نسال الكانديديت Do you have any questions؟ فدائما جهزوا لنفسكم سؤال او سؤالين يعني تكون مفيده just to show them that you did your homework and you're serious and you're really interested. مو انه بس كده والله قدمت يعني لانه معدلي عالي ولا لانه يعني just to see if يعني انا مثلا احب التخصص ثاني وبس انا مقدمه كده. فلا لازم نجهز اسئله وتكون اسئله مفيده عن البروجرام. مثلا خلينا نجيب مثلا مثال. مثلا عندكم academic day في البروجرام. متى تقريبا متى الاكاديميك day؟ how many hours is it protected time؟ زي كذا. هذا مثال مثلا بسيط. mock interviews هذه مرة مهمة. قبل ما تدخل الانترفيوز you have to practice simulation زي simulation. الحين ما في عذر. Everyone needs to practice. They need to conduct mock interviews with mentors, if possible peers, اللي هم ممكن مثلا مع residents, previous residents, زي يعني لو عندكم أصحاب سابقينكم ممكن برضو نستعين فيهم, or through professional services or ChatGPT. هقول لكم بعدين النهاية كيف نسوي ChatGPT. في خاصية مرة حلوة إنه we can practice interviews بالChatGPT. Feedback. Seek for constructive criticism to improve your answers. يعني بعد ما تسوي الموك خلي اللي سوى لك الموك اكزام او الموك انترفيو يعطيك feedback and be open for criticism. Don't take it personal. Ask him to criticize you to improve your answers, body language, and overall presentation. خليك يعني ما عليه الآن يعني it's better for you to be criticized now before the interview than إنه being criticized جوا الانترفيو. يعني no hard feelings. لا تاخذوا بشيء personal. It's just for you to improve. Simulation. Try to simulate the interview environment as closely as possible, including the format, whether virtual or in person. Try to simulate يعني خلي الجو كأنك عيش الجو حق الانترفيو في قاعة. فاستأجروا طاولة. دحين في ورك ستيشنز ممكن نستأجر محل نجلس فيه و1 to 1 كده مع أو نجيب جروب نتفق معاهم to interview you. just to mimic the real thing. طبعا الواحد مهم إنه يكون mentally prepared for the interview. What do I mean by mental preparation? Confidence. You have to build your confidence by reviewing your past accomplishments and strengths. كلنا أكيد أنتم كلكم جميعا ما وصلتوا ما شاء الله لهذه المرحلة إلا عندكم accomplishments وعندكم نقاط قوة. you need to review everything that you have accomplished in the past. This will give you and boost up your confidence. Practice relaxation techniques. Learn techniques to manage anxiety, such as deep breathing or visualization exercises. في دحين تطبيقات وapps في virtual reality apps برضو can help you to practice relaxation techniques. هذه important عشان ما تيجي الانترفيو ويصير لك mental block لأنك mentally you weren't prepared. You need to prepare your mind. Logistic preparation برضو لا تقل أهمية. إيش معنى logistical preparation؟ إنه لو كانت مثلا أنت في مدينة ولازم تسافر مدينة أخرى سواء abroad ولا جوا السعودية مثلا من الرياض لجدة أو العكس. إذا كانت in person, make sure that the travel arrangements are made well in advance. يعني كل شيء جاهز، ما نجي لآخر لحظة نحجز نقول والله ما في حجز أو ما لي وقت متأخر ما هو مناسب وبكرة عندي انترفيو من الصباح. We have to book and arrange everything in advance. بالنسبة لو كانت virtual طبعا you have to do your technology check like for virtual interviews like Zoom. Ensure a stable internet connection and familiarize yourself with the video platform being used. ما نجي يوم الانترفيو والله قاعدين نجرب زوم أو أي برنامج آخر أول مرة. لازم قبل ما يوم الانترفيو قالوا لنا والله أنت على زوم ولا على أي برنامج آخر، نجهز نفسنا نجرب البرنامج trouble shooting. لو في مشكلة نعرف الصوت، في مشكلة الصورة ليش مو قاعدة تطلع، الباك جراوند كيف نظبطه، كل هذا قبل الانترفيو. ما نجي يوم الانترفيو إلا إحنا خلاص نعرف نستخدم البرنامج. بالنسبة للانترفيو تكنيكس، إيش الكومن انترفيو questions اللي إحنا عادة نسألها؟ هذه في أي مكان سواء في السعودية برا السعودية ما حتخلو الأسئلة من هذه الكاتيجوريز الأربعة. الأسئلة اللي تنسألوها في interviews can be either personal or behavioral, ethical, and finally situational. ما حتخرج من هذه الأربعة. إيش معنى personal؟ Questions about your background, interest, motivation for pursuing plastic surgery. هذه أول سؤال تنسألوه لما تجلسوا. يا عبد الله, tell me about yourself, your background. Why did you choose plastic surgery? كأنه البيرسونال statement اللي بتكتبوها بس هذه orally. You're presenting it oral يعني شفويا. النوع الثاني من الأسئلة اللي هي behavioral. These are designed to assess how you handle specific situations or challenges. هعطيكم examples بعد شوية. النوع الثالث اللي هو ethical. Questions to evaluate your judgment and decision making in complex situations involving moral conflict. وآخر نوع اللي هو situational اللي هي يعطيك hypothetical scenario related to the medical field to gauge your critical thinking and problem solving abilities. فالأسئلة ما حتخرج من هذه الأربع categories. أعطيكم أمثلة. هذه sample questions. بالنسبة للpersonal, why did you choose plastic surgery as a specialty? Behavioral, tell us about a time you dealt with a difficult colleague or a patient. How did you handle this situation? Ethical, if you noticed a colleague making a consistent error that could affect patient care, مثلا you're senior, يعني senior resident أنت junior resident وهذا السينيور معك is making consistent errors that could affect your patient care. What would you do? They want to test your ethical values, your moral values. Situational, how would you manage your time if you had multiple urgent tasks at once? فهذه كلها sample questions. Tips for answers. طيب كيف نجاوب على الأسئلة هذه؟ إيش التبس؟ أهم شيء عندنا honesty. Always be truthful in your responses. لا تكذبوا أبدا. إن سألت سؤال جاوبوا بكل صراحة. طيب أحسن من الواحد يكذب ويبين إنه كذب لأنه ما في يعني الواحد we can pick it up. إذا واحد بيكذب you can always tell if a person that's in front of you is lying. So always be honest. Reflection, مو لازم أجاوب على طول. أنا المشكلة يعني كنت أشوفها يمكن بعض الابليكنتس إنه لازم يجاوبوا على طول. ما يحتاج إني أجاوب على طول. Take a moment to think before you answer. يعني pause إذا كان ال question كان complex or unexpected، وبعدين أخذ نفس وأجاوب. عشان إيش؟ أستوعب السؤال، مو بس المهم إني أجاوب. طيب، الشيء الثاني بالنسبة للbehavioral questions، في طريقة حلوة ممكن نستخدمها اللي هي يسموها STAR method for behavioral questions. This is the way you can answer. You can try the STAR method, which is very useful. The STAR stands for S, a situation. مثلا أنا أقول مسوي situation معين، هذا هو ال S. ال T, a task. مثلا I was asked to deal with a difficult patient. ال action, what I did، وش المانوفر أو ال strategy that I followed to deal with this difficult situation. بعدين ال R اللي هو حدث ال result. فهذه طريقة حلوة الواحد ممكن يتبعها في هذا النوع من الأسئلة. بالنسبة للrelevance، tailor your answers to highlight the skills and experience relevant to the role of a resident in plastic surgery. لما تنسأل أي سؤال من هذه الأسئلة، دائما حاول إنك تفصل الجواب على إنه إيش تبين للكوميتي أو اللجنة إنك أنت interested فعلا في البلاستيك. مثلا لما يقول لك tell me about yourself، يقول أنا مثلا أنا فهد الجندان، مثلا تخرجت من كليه الطب وبعدين مثلا سويت الكتب في البلاستيك وعجبني البلاستيك، فاي tailored my answer بحيث انه I include my ابين للكوميتي انه انا انترستد في البلاستيك. مثلا مثلا لما سالوا لي سؤال في الاشياء الصعبه difficult situation، مثلا اوريهم انه انا meticulous، وهذه كلها من الصفات اللي او البرفكشنست اللي نحب انها تكون في البلاستيك سيرجري applicants. فدائما you try to tailor your answers to highlight your skills and experience relevant to the role of a resident in plastic surgery. Brevity، try انه ايش معنى brevity؟ انك keep your answers concise and focused. لا تضيع الكوميتي او اللجنه. دائما دائما جاوب على قد السؤال، ما يحتاج اني يعني استرسل كثير في الاجابه عشان ما يضيع الفوكس ويكونوا متابعين معايا، لانه تعرف فيك ابلكنتس كثير فالوقت ضيق، فبرضه في نفس الوقت ما نبغى انه نسترسل كثير في الاجابات. طيب ايش الpurpose of this question? Why are we asking all these questions? We want to assess the fit of the applicants. We want to see if you will be a good fit for the program's culture and the demands of residency. نبغى نشوف الابليكنت هذا ينفع ولا ما ينفع. يمكن مثلا هذا الابليكنت ما يتحمل الستريس، ما يتحمل الديفيكولت سيتويشنز، ما هو اصلا interested مو مبين motivated، فهذا he's not a good fit. Evaluate the skills. You want to understand we want to understand your communication skills, professionalism, and clinical reasoning, which are also essential aspects of a plastic surgery residency. We want to understand your motivations. Programs are interested in why you are pursuing a residency in plastic surgery and your long-term career goals. فهذا هو الهدف من الأسئلة. To assess your fit, evaluate the skills, and understand your motivations. طيب، في يوم الانترفيو ايش اللي لازم نسويه؟ ايش نجيب معانا؟ Bring extra copies of your CV. Always have a few copies on hand in case you need to provide one to an interviewer. يعني جيب معك كوبي، لانه احيانا يمكن يكون ضاع، ما كانت الطابعه خربانه هذاك اليوم whatsoever، فانت دائما تكون on top of things وجاهزين. نجيب معانا copy of our CVs. List of references تكون جاهزه برضو معانا. Be prepared if asked for professional references. Bring a notepad and a pen for taking notes during the day, especially when asking questions after the formal interview. يعني نجيب معنا ورقة وقلم أو نوت باد صغير ندون فيه بعض الملاحظات اللي ممكن تفيدنا. Personal identification. Some programs may require a form of ID for verification. لازم نجيب الاي عشان نثبت والله انه انا فهد ولا انا عبد الله ولا انا محمد او انا ساره او عبير. لازم نجيب معانا بطاقة الأحوال أو إثبات شخصية. portfolio of work بالنسبة لنا إيش البورتفوليو؟ عبارة عن if applicable إحنا عندنا طبعا research يمكن أكثر شيء، أو presentations هذه اللي ممكن نجيب مثلا والله عندي شوف هذه publications، إذا سألوا إيش الببليكيشن والله أنا عندي هذا research papers، هذا اللي I was involved in وزي كذا، هذا البورتفوليو حقنا اللي ممكن يخدمنا في الانترفيو. what to wear إيش نلبس؟ طبعا هذا شيء مهم، كثير ناس ياخذوه lightly but don't take it don't never take it lightly. في dress code. You have to be professional, wear a professional attire, wear a suit or professional outfit that fits well and is comfortable. لا تجوا بسكرابز ولا يعني دائما السكرابز تعطي كذا انطباع انه it's not يعني ما هو professionally اجي سكرابز او جينز مثلا في انترفيو. I have to wear something suitable يعني يعكس انه انا I made an effort اني to wear something suitable and professional. Conservative colors, choose colors that are generally considered professional like black, navy or gray. هذه الألوان اللي تعتبر professional. Minimal accessories. Keep accessories to a minimum to avoid distraction. لا تجوا مثلا بأساور وحلقان والله ويعني يعني الواحد يقلل يخلي يعني الشيء مهم، بس ما أجيب accessories من راسي لرجلي وأجي الانترفيو. What to do في اليوم الانترفيو: arrive early, plan to arrive at least 15 to 20 minutes early to account for any unforeseen delays، لأنه أحيانا ما تدري إيش يصير، ممكن فجأة حادث في نص الطريق، يمكن أضيع مثلا ما ألاقي القاعة، ما أبغى أكون في ستريس، أنا already stressed من موضوع الانترفيو. يعني I don't need additional stress in my life. ايش انه والله ادور القاعه ماني لاقيها، الباب مقفل لازم كود وانا ما اعرف الكود وما في احد يفتح لي. كل هذه الاشياء ممكن تحطني في ستريس انا في غنى عنه اذا انا بس وصلت بدري وقدرت مانج او اوصل في الوقت المحدد وقبل كمان الوقت المحدد. Greet everyone politely from the receptionist to program director. Treat every interaction as part of the interview. يعني من يوم ما وصلت المستشفى خلاص اعتبر نفسك او مكان الانترفيو سواء مستشفى او غيره، اعتبر نفسك خلاص انه انا دحين بدات الانترفيو. ف treat everyone politely. Mind your body language. انتبه للبادي language، مره مهم هذا الشيء. احيانا يمكن كلنا ما ننتبه للبادي language when we take it like lightly بس it can tell a lot to the خاصه اللجنه ما يعرفوا هذا الشخص اللي قدامهم، فيبغوا يشوفوا اي شيء اي ساين ممكن يعكس لهم هذا الشخص ايش هو، هل هو honest is he lying. اقروا كتب عن البادي لانجوج، هذه انصح فيها، في كتب حلوه عن البادي لانجوج ارسل لكم بعدين اسمائها، ممكن تساعد برضو في الانترفيو. maintain good posture, eye contact, a firm handshake. مثلا لما الواحد يتكلم ما يجي يحط يده على فمه، هذه احيانا يعني اتس ترفلكس انه انا قاعد اكسب لما انا اجي اتكلم واحط يدي على فمي. طيب هذه معروفه في البادي لانجوج ساينس. لما مثلا احط يدي في جيبي كاني انا قاعد اخبي شيء وانا قاعد اتكلم، فلازم بالعكس تخلوا يدكم على واضحه على الطاوله. هذه برضو اشياء بسيطه it makes a big difference، خاصه ال eye contact is very very important. Mind your body language. During the interview, listen carefully. اسمع. Make sure you understand the question before you begin your answer. عشان كده قلت لكم من اول pause. لما تيجي تسأله pause شوية، خذوا نفس، فكروا في السؤال بعدين جاوب. مو بس المهم اني اجاوب. Be concise. برضه قلناها answer question directly and avoid rambling. لا تلف وتدور. خلاص سألت سؤال جاوب على قد السؤال directly من غير لف ودوران. حتى لو be honest، حتى لو انت والله you trying to avoid مثلا answering the question، لا try to do it smartly. لا تلف وتدور. Be engaging. Show enthusiasm for the program and the field of plastic surgery. How to handle difficult questions. طبعا أكيد في difficult questions. You will be asked some difficult questions. The most important thing is to stay calm, take a moment to think before answering the challenging questions. هذه كم مرة نقولها ونعيد نزيد فيها لأنها مهمة. Honesty برضو مهمة. If you don't know the answers, it's better to be honest than to try to fake it. Try to turn negatives into positive. When discussing past challenges or failures, focus on what you learned and how you grew. مثلا قالوا لك أنت ما عندك research papers، حنتكلم عنها يمكن هذا بعدين. عندك مثلا you didn't do any research, you didn't attend any conference. How you will turn this into a positive? Try it when you answer. مثلا والله صحيح إن ما سويت research بس أنا I was يعني I joined researchable حق الدكتور هتان والدكتور عبد الله قرشي يمكن هذا اللي فأنا I'm trying to learn أنا because I'm weak in research مثلا I'm trying to build up my research skills and knowledge, so I joined the course, and this will hopefully help me improve myself and publish in the near future. فهذه أحد التكنيكس الممتازة for turning negatives into positives. طيب خلصنا من الانترفيو وخلصت الانترفيو. After the interview إيش نسوي؟ Debrief. Take a few minutes to write down the notes about what was discussed and any follow-up items. هذه for your own. اجلس مع نفسك، جيب كتاب وقلم وورقة واكتب ايش صار. Networking. Use any additional time you have to network with the current residents or other interviewees. طيب هذه كويسة برضو الواحد ايش يوسع دائرة معارفه. Professional courtesy. Thank any staff member who assisted you throughout the day. بعدين بعد الانترفيو في شيء يسموه post interview etiquette. Thank you notes. It would be nice to send thank you notes to those who interviewed you just to discuss the importance of following up. يعني مهم انه ارسل thank you note just to show that you're thankful. It would be nice انك ترسل رسائل or emails. وكمان I can ask for a feedback. How to ask, learn how to ask for a feedback بعد الانترفيو and utilize post interview feedback. مهم برضو انتم مثلا رسالة thank you note وبعدين مثلا I would like to have a feedback عن إجابتي في السؤال هذا كيف كانت، هل كانت كويسة، هل كانت ممكن بس يمكن مو في البداية نسويها بعد الانترفيو. بعد مثلا ما تطلع النتائج مثلا أنا حسيت ما انقبلت فأبغى أعرف حسيت نفسي مثلا كان السبب الانترفيو. ف I can always ask for a feedback just to improve myself for the future. طيب هذا مثال بسيط. Imagine you were asked about a gap in your research activity during the interview. How would you address this? Number one, explain the reason for the gap honestly, emphasizing what was learned or how you grew during that time. Number two, or option number two, discuss other productive activities engaged in during that period, such as clinical work or further education. ثلاثة, تحاول إنك to steer the conversation toward achievements and contributions before and after the gap. Number four, or option four, express intent and plans for future research endeavors showing a commitment to closing the gap. Number five, briefly acknowledge the gap and then redirect the conversation to a more recent or relevant experience. فأي واحدة من الإجابة would you choose؟ بنقدر نسوي البول نبغى نشوف الأودينس إيش حيختاروا. أبغاكم كلكم تقرأوا الإجابات وتعطوني إيش الجواب اللي ممكن تجاوبوه من هذه الخمسة. عبد الملك, can we do that?
Yes, sure.
أنت بس حط 1 2 3 4 5 مو لازم تكتب الكلام هم حيقرون من هنا صح. ف we can just put one ونشوف إيش الجواب الأكثر أو الأغلبية إيش حيختاروا.
يعطيك العافيه دكتور. اذا ممكن بس يشاركوا على الشات في الكيو ان اي لانه البول بس مو راضي كان يشتغل معنا.
أوكي طيب مو مشكلة. يا شو طيب ابغاكم كلكم تكتبوا، كل واحد يكتب جواب وبشوف الاغلب ايش بيجاوب. ما حقول لكم جواب صح ولا جواب خطأ، ممكن اكثر من واحد يكون صح، ممكن كلهم يكونوا صح، ممكن كلهم خطأ. just answer وانا بعدين حنتكلم ونتناقش. يلا نبغى على الاقل نص الحضور، عندنا 55، نبغى على الاقل 27 28 جواب. طيب وصلنا 11، فين الباقيين؟
تقدرون أنكم تكتبون الأجوبة في الشات.
يمكن ما استوعبوا بعضهم، انه الواحد
هذا
بس يحط، ايوه يحط رقم، يختار كذا في الشات يحط رقم ايش يبغى، اي جواب عادي.
بس
هو
كيف
ترى يمكن عشان هو شوف، عشان كمان I understand يمكن بعضهم يعني confidential او ما يبغون عشان البرايفسي، ما يبغوا which is understandable صراحة. عشان كذا انا كنت افضل البوست. بس anyway آم طيب ما حنحدد اسماء ولا حنقرا الاسماء، بس انا ابغى اعرف الاغلبيه ايش جاوبوا. لأن بعضهم اصلا بيكتبوا انه الشات disabled، عشان كذا يمكن ما بيقدروا يجاوبوا. ما اعرف ليش بعض الناس يجيهم disabled. طيب بالنسبه للاجابات لو لاحظتوا حتلاقوا تقريبا كل واحد اختار جواب، يعني ما في ناس زي بعض، في بعضهم مكرره طبعا، رقم واحد كثير يمكن اختار، في بعضهم اختاروا خمسه. طيب طبعا واحد واثنين ثلاثة وأربعة كلهم صح. طيب ما في واحد، هو يعتمد على السيتويشن حقك كيف حتجاوب، فما في واحد صح وواحد خطأ. خمسة يمكن هو اللي least favorable، انك you don't want to redirect the conversation to يعني انك هنا قاعد تتهرب من السؤال to a more recent or relevant experience. لانه يعني مو حلو انه صح انه you acknowledge the gap، هذا ما يكفي، بس you want to show اللجنة how you would fix what يعني التقصير هذا. فلو لاحظنا رقم واحد قال لك انه كان honest. honesty is sometimes enough just to be honest. والله كان عندي ظرف انا ما قدرت مثلا، فذاك الظرف كان it was a very busy rotation. I'm honest، ما قاعد الف وادور، انا I didn't have مثلا، او اني مثلا I took some time off فما كان عندي وقت، جاتني ظروف مرضت. it's fine. بس انه at the same time this motivates me to work harder and to يعني take courses, to seek مثلا research clubs just to be involved in a research. طيب هذه one way of doing it. الطريقة الثانية اللي هو discuss other productive activities during that period such as clinical work or further education. مثلا انه انا صحيح ما سويت research، بس انا اشتغلت مثلا في هذه الفترة مع بروف قطان مثلا واستفدت منه كثير، شفته هو كيف قاعد يكتب البيبرز، فاستغليت هذه الروتيشن باني انا اتكلم معاه عن his projects وعن how to conduct مثلا systematic review. فهذا برضه خدمني بحيث انه انا في المستقبل اقدر اسوي بيبرز تكون تظهر بشكل لائق ومناسب. رقم ثلاثة اللي هو steer the conversation towards achievements and contribution before and after the gap. هذه برضه strategy useful. ممكن اقول له انه انا صحيح ما سويت research، بس انا في الفترة اللي فاتت I was collecting data، لانه مثلا قبل يعني I was collecting data ولسه ان شاء الله حيجهز قريب. صحيح انه انا دحين ما عندي بروجكت جاهز، بس انا on the process I'm waiting for the IRB، بس انا عندي الفكره وكل شيء جاهز. او انه after مثلا the gap انا صحيح I'm not involved in research بس I made مثلا اتصالات أو مثلا مع colleagues و we are working on something soon. فهذه برضو طريقة كويسة. Number 4 اللي هو express the intent and plans for future research, showing commitment. برضو هذا زي ما قلت المثال، يمكن انه انا مثلا I will join a research course soon لانه انا ضعيف في الريسيرش، ف that's why I couldn't maybe conduct any clinical or whatever any case report ولا cross sectional study، لانه انا ما عندي خبره كيف تسوى، بس انا سمعت عن كورسز بتنعطى اونلاين، ف I will join one soon. سجلت وان شاء الله قريب حاحضر الريسيرش وبعدها حاصير اقدر اسوي البيبر. نمبر 5 ما هي it's the least favorable، لانه انت مثلا اعطيكم مثال عليها، قال لك انت والله ما عندك ريسيرش، كيف انت يعني تقنعنا انك انت يعني interested في البلاستيك وانت ما عندك اي ريسيرش او بيبر بالبلاستيك؟ والله انا صحيح ما عندي ريسيرش بس انا سويت 2 electives in plastic. طيب يعني هذا ما يعني انت قاعد تتهرب من الجواب، ما اعطيتني، ما جاوبتني على سؤالي ايش دخل، انا الحين قاعد اسال عن ريسيرش. فيور صحيح انك قاعد توجهني انه انا اسوي او توجه تلفت انتباهي انه انا انك عندك انجازات في البلاستيك، انك حضرت كونفرنس ولا انك سويت electives، بس انت ما جاوبت على السؤال وقاعد تتهرب منه. فهذا هو الليست فيفوربل، هذا اللي ابغى اوصل لكم هي. يعني كل هذه الطرق صح اللي هي الاول 4، بس 5 I don't think it's right او it's favorable but it's better to avoid it. طيب just to recap of the key points, interview preparation is important. It's the importance of thorough research, understanding one's own CV, and practicing with mock interviews. Interview day tips essential for the interview day, such as professional attire, lips, punctuality, انك تجي على الوقت وقبل الوقت, and bringing necessary documents اللي قلنا عنها CV and references and IDs and notepad. Answering question strategies for answering different types of interview questions effectively اللي قلت لكم عنها البيهيفيرال السوشيال اللي هي مش كانت الباك جراوند ايش كانت الرابعه؟ المهم نرجع لها بعد شويه. Post interview etiquette, importance of follow up, thank you notes and seeking feedback. طيب Q&A.
يعطيك العافية دكتور على وقتك وجهدك معنا. في حال أي أحد كان عنده question بإمكانه الكتابة عن طريق الشات. meanwhile دكتور يعني فيه بعض الأسئلة اللي ممكن نوجهها لك. دكتور احنا نعرف أن يعني اهتمامك بالذكاء الاصطناعي الارتفيشال انتليجنس وبتطبيقاته. فدكتور من خلال يعني خبرتك كيف ممكن يعني هل في طريقة ممكن نوظف فيها الذكاء الاصطناعي في التحضير للمقابلات الشخصية؟
نعم في طريقة جدا جميلة. امس جربتها انا، للاسف انه انا عندي لانه انا using ويندوز لابتوب، فلما جيت ابغى احمل التطبيق لانه مو موجود في الاوبن اي اي ويب سايت الفويس شات، الفويس شات جي بي تي الفويس شات، فبس موجود في الاب اللي على الجوالات. فلما تدخلوا على الاب هتلاقوا في اوبشن حق الفويس شات. فانت طبعا اول شيء you have to train الشات جي بي تي، تقول له عن طريقه الاسئله انه ابغاك تسالني اسئله في البيهيفير في السوشيال في نرجع لكم هي البيرسونال behavioral ethical and situational. طيب نقول لها مثلا هذه الكويستشنز ابغاك تجيبي لي عليها امثله، او تجيب لي انا لانه اللي عندي فيميل فيهتم انت ايش اللي يتكلم معه. ف يو تيون فاين، تسوي له فاين تيونينج وبعد وتبرمجه الشات جي بي تي، وبعدين تقول له يلا اسمي. فهو حيختار لك سؤال، قول له انت اسمي، وبعدين استنى wait for my response، وبعدين I want you to evaluate me at the end ويعطيني فيدباك. فحتلاقيهم تعطيك situations وتجي سواء personal behavioral ethical situational، وبعدين انت تجاوب على الاسئله، وبعدين at the end it will give you a feedback. ف it's very very nice، كأنه شخص فعلا جالس قدامك وبيختبرك. فأنا جربتها و it's very very nice صراحة. يعني ويعني she brought up scenarios كأنها real، كأنك في interview فعلا. يعني بعضها ethical questions، بعضها زي كذا difficult situation how to deal with it. ف يعني جربوها كلكم، اللي عنده تشات جي بي تي 4 should try it definitely. هذه نوع من انواع الموك اكزام براكتس. اللي عنده، اللي صعب مثلا يلاقي احد يختبره او يقعد معاه، ما في اكسكيوز. دحين مع التكنولوجي we can utilize it في هذه الامور.
جميل جدا، الله يعطيك العافية. كثير من أسئلة الحضور راح تجاوبها يعني جزئية دكتورة طيف. لكن دكتور، في برضه سؤال آخر يعني بالنسبة لك شخصيا، يعني في هل are there يعني certain scenarios or questions that you intentionally include in interviews to assess the candidate's adaptability and problem solving skills؟
نعم صحيح، في كثير من الاسئله مثلا بالbehavioral، زي مثلا انه مو مثلا انه ايش، لا مو سوري، اتس ethical question. مثلا انه لقيت يعني نبغى نعرف انك you're following مثلا ال chain of command او ال hierarchy. مثلا انت you're doing your rounds، وبعدين لقيت مثلا ال patient مثلا ال drain output is very high. طيب كان امس مثلا سوى abdominoplasty or whatever، ولقيت انه drain is bloody و very high output. What would you do next؟ هل انك تروح مثلا حتكلم الكونسلتنت، ولا حتكلم الريزيدنت اللي فوقك؟ فزي كذا. فانت لما تروح تكلم الكونسلتنت، هم ما حيقولوا لك، يعني ما هي مالتيبل تشويس، هم حيقولوا لك what will you do. فمثلا انت تقول لهم انا I will follow chain كمان، مثلا اروح اكلم السينيور ريزيدنت واقول له انا لقيت كذا فايش رايك؟ وبعدين هو، فانك ما تتجاوز your senior وتروح للكونسلتنت. هذه one thing. الشيء الثاني مثلا يبغوا يشوفوا مثلا برضو انه مثلا اتصلت عليك النيرس مثلا قالت لك يا عبد الملك تعال البيشنت مثلا I think the flap looks pale مثلا. فما تيجي تقول لها والله لا كلميني بعد 5 دقائق مثلا حطي ورم. لا، يبغوا يشوفوا انك تجي انت بنفسك you assess the situation. طيب ورا الاكزامينرز انه انت you're cautious, you're meticulous, you're paying attention to details. ما تعتمد على كلام النيرسز، تجي بنفسك you assess the situation. ممكن تلاقي شيء مثلا ما قدرت توصل لك هو النيرس مثلا. فهذا برضه مثال ثاني يبغوا يشوفوا are you a safe surgeon ولا لا. مثلا difficult situation زي انه انت قاعد في الاو ار وفجأة صار bleeding، ايش حتسوي؟ you will freeze، you will وجاء على وجهك مثلا الدم، ايش حتسوي؟ you will freeze، you will apply pressure، you will يعني panic. يبغوا يشوفوا انت how you will handle the situation. فهذا برضه مثال ثاني. طبعا بالنسبه للموتيفيشنز والبيرسونال questions، احيانا يبغوا يشوفوا انت هل عندك نيه انك تطلع برا، ولا انك تبغى تكمل في اللوكال بروجرام. لانه كثير بعض الناس يجوا هو عنده المنتاليتي انه انا لا والله انا ما ابغى لوكال، ابغى برا. من حقه، ما حد يقدر يقول له شيء. كل واحد له هز يعني اهدافه، له يعني مثل كلنا كبار، وكل واحد ما حد يقدر ايش يجبرك على شيء. انت اللي شايفه صح تسويه في النهايه، واللي يناسب ظروفك ويناسب رغباتك. فانت بس you have to be honest. هذا اللي كنت اوصل لكم. هو لما يقولوا لك والله انت الحين افرض انك انت انقبلت في اللوكال بروجرام، وبعدين جاك اكسبتنس مثلا في كندا، ولا جاك اكسبتنس في فرنسا، ولا وات ايفر، هل حتطلع؟ فانت بي اونست. يعني هذه ماي يعني ماي ريكومنديشن انك to be honest. لا تكذب. don't try to ramble around. لا، خليك دايركت. والله شوف انا صراحه مثلا احب اللوكال بروجرام I'm very sure إنه it will add a lot to me and make me a good, very good plastic surgeon. بس أنا صراحة for some reasons أنا أحس إني مثلا لو طلعت برا حكون أفضل مثلا. فأنا أفضل إني أطلع برا. هذا من المثال، أو العكس صحيح مثلا. ف always be honest. هذا اللي أبغى أوصل لكم هنا. Don't try to hide information أو إنك تكسب. لا، كله حيبين في النهاية.
جميل جدا دكتور. طيب دكتور، في أحد الأسئلة يعني اللي كثير من يعني تجينا، لكن إلى الآن ما نعرف إيش الإجابة الأمثل لها. يعني واحدة من الأسئلة لو قال لي مثلا بروجرام دايركتور أو الانترفيور إيش هي الويكنس بوينت فور يو، يعني هل المفترض أننا نعدد الويكنس بوينت أو أننا نحاول نجيب الإجابة بطريقة نموذجية؟
شوف، دائما أنت تكون ذكي، جاوبوا بذكاء. يعني ما في أحد كامل طبعا، كلنا عندنا ويكنسز، عندنا مواطن قوة وضعف. بس ما تبغى كمان في النهاية تبين نفس للاكزامينرز او مو الاكزامينر، اللي هم الانترفيورز، انه انت والله مليان عيوب وانك ما تنفع. طبعا اصلا انت ما وصلت للمرحله الا اكيد ان انت قدها وما شاء الله ومتمكن وكل شيء. فانت حاول انك مثلا if you want to answer this question مثلا، آه انا اقول لك مثال انا ايش كنت اجاوب هذا السؤال، بس مو كلكم تقعدوا تجاوبوه دحين تغش. آه مثلا انه انا ايش نقطه ضعفي، انه انا يعني I get so involved in work that I omit مثلا social obligations. I become يعني sometimes I become so engaged in work or involved that I omit social obligations or gatherings. فهذه نقطة ضعف فيا at a personal level. فممكن أنا أجيبها بهالطريقة. It's smart وفي نفس الوقت بينت لهم إنه أنا dedicated وإنه أنا شغلي مهم. فهذه one way of doing it. انت طبعا you can find your own scenario، بس انا اقول لك هذه واحده من السيناريوز اللي انا او الاستراتيجي اللي انا كنت استخدمها. فهذه واحده من الطرق. ما في اجابه صح واجابه خطا، بس في النهايه كمان ما تبغى تبين للناس او الفاكولتي انك انت كلك عيوب، انك انت يوزلس اقعد في البيت ما تنفع مني. لا، الا طبعا لو في اشياء ميجر واشياء يعني صحيح موجوده فيك اوكي. بس لو في اشياء ما تجي انت بس عشان تبغى تبين لهم انه انا والله اونست، وانا اجي انه انا مثلا صراحه ما احب الانكولات، انا هذه نقطه ضعفي انه انا ما اقدر اسهر، انا مثلا احب البلاي ستيشن ما اقدر اني اسيب البلاي ستيشن. لا، بي سمارت لما تجاوب على هذه الاسئله. تقدر انت تسوي فلتريشن للاشياء اللي ممكن تنقال والاشياء اللي ما تنقال.
جميل جدا دكتور. دكتور راح نختار تو questions من الشات بعد الآن، وبقية الكويستشنز إن شاء الله راح نجاوبها بعد ما تنتهي دكتورة طيف من جزئياتها إن شاء الله. السؤال الأول كان يقول what happens if the candidate was not able to answer questions assessing knowledge.
طيب، مهم هذا السؤال. شوف، احنا عاده المفروض ما نسال knowledge. طيب، وحتى لما نسأل knowledge just to see the way you're answering the question. يعني um, يعني هل انت المهم انك تبغى تجاوب بس for the sake of answering، ولا انك والله شو اسمه يعني لا you made an effort، فكرت في الجواب، بس هذا اللي طلع معاك based on your level والاكسبوجر حقك. مو متوقع منك انك تجاوب ideal answer، بس برضو كمان احنا طبعا نحب نبغى نشوف your approach. مثلا هل انت فكرت مثلا قبل ما تجاوب ولا بس جاوبت؟ في ناس بس يجاوبوا كذا، يعني المهم انه جاوب، عرفت؟ حتى هو ما هو عارف الجواب و he knows and he doesn't know the answer، بس يبغى يجاوب. فانا لا، هذا غلط، هذا بالعكس، هذا يعني will reflect badly عليه. فعشان كذا لازم we have to pause، take a moment or two، think about the question، وشوف والله انا حسيت انه هذا السؤال والله صعب، انا ما قد اتحطيت في موقف زي كذا. ف I try اني اقول لهم صراحه honestly I don't know. طيب، مثلا احيانا ايش ممكن يسالك؟ يقول لك ايش العمليات اللي انت سويتها؟ طيب، انا وانك شاركت فيها. ممكن اقول له انه انا شاركت مثلا في تندن مثلا مثلا بوليسايزيشن. طيب بس انا ما اعرف ايش انا حضرت العمليه بس انا والله مو براسي ماني عارف ايش كان قاعد يصير، فما اجي اقولها. عرفت؟ this is الواحد لازم يكون سمارت، ما يجي يفتح على نفسه باب. انت you have to direct the examiners او الانترفيورز، انت اللي تبغى توجههم. تيجي مثلا انت عارف نفسك انك انت تعرف الابدومينوبلاستي مثلا مره كويس، ولا بريست ريدكشن، ولا هذا. انا حضرت عده عمليات و I can tell يعني I can describe it from A to Z. فاجي اقول له breast reduction، يلا ابغى يسالني الحين breast reduction. طيب يلا قل لي كيف البريست ريدكشن تسوي؟ ايش الماركينج؟ ايش مو الماركينج يعني؟ ايش الستبس مثلا؟ فاجي اقولها لانه انا اصلا ما قلت هذا الجواب اللي انا عارف اني حقدر اجاوب على الاسئله اللي بعدها. فهذا الطريقه اللي انا مثلا انا طبعا بقول لكم عن تجربتي كيف كنت اسوي لما انحط في موقف كذا. اجيب لهم مثلا امثله لاشياء انا عارفها ومريت فيها، ما اجيب اشياء انا ما انا ويك فيها. توضح الجابس اللي عندي. عرفت؟ ما تبغى توريهم انه في gaps in your knowledge. صحيح انك انت at this level you're not expected، مو expected منك a lot، بس برضو ايش اللي يميزك عن غيرك؟ وخاصة انه في منافسة كبيرة وتعرفوا انتم عدد البوزيشن قليل، لازم برضو ايش؟ احاول اعطي افضل ما عندي من ناحيه النولج. حتى لو انا مثلا ماني مره knowledgeable، بس زي كذا في تكنيكس معينه I can direct them towards الشيء اللي انا ابغاهم يجاوبوه. الا طبعا لما يجي يسالني كذا direct question، مثلا والله قل لي ايش الابدومينوبلاست وانا ما اعرف، وقتها اقول له والله انا ما اعرف. انا مثلا I wasn't involved في abdominoplasty، I wasn't involved in the breast reduction procedure، كلها 4 اسابيع وهذاك الوقت ما كان. فما حقدر وما حد حيلومك في النهايه. بس انت تجي تقولها بعظمه لسانك وبعدين تجي تتوقع منه انه يكون راضي انك لا. انت لا تقولها من البدايه. لو هو خلا اعطاك open ended question ايش سويت عمليات، لا قول الشيء اللي انت تعرف.
جميل جدا. ننتقل للسؤال الأخير دكتور. how about يعني هذا في السؤال في الشات يقول لك how about if I wasn't interested in plastic then when I start my internship I find my interest in plastic and I took one elective and I started one research. Is this will affect me badly or not?
يعني انه بس عنده انه ما عنده السي في حقه is not يعني filled with plastic surgery things. شوفوا انا دائما اقول انه at this level طبعا ما هو expected a lot، بس برضو احنا عندك ample يعني عندك وقت. لسه الانترفيوز كم هي عليها؟ ف you can enhance your CV. احضر كونفرنس هنا حتى لو اونلاين الحين ما شاء الله مع الزوم كده والاونلاين كونفرنسز الواحد يقدر يحضر عشرات الكونفرنسز in one day. طيب وكان يملي السي في حقه باشياء. الريسيرش بي انفولد ان ريسيرش من الان. كلم بسهوله البلاستيك سيرجري انترست كلب، انا انترستد ان ريسيرش بليز هوك مي وذ او اتاتش مي مع كونسلتنت معين بيسوي ريسيرش عشان يكون اسمي معه. اقدر احضر اوبزرفيشن مثلا ما قدرت الكتف اجي احضر اوبزرفر مثلا، اخذ اوف مثلا سم تايم اوف واحضر اوبزرفر. فما في اكسكيوز. الواحد حتى لو هو كان لاست مومنت ديسيجن انه يدخل بلاستيك برضه يقدر يعني يلحق على نفسه ويضيف للسي في حقه. طبعا من الاشياء اللي انا بلاحظها ودائما بقولها للابليكنتس لما تيجوا تقدموا السي في حقكم، لا تقدموا بس السي في وتملوه كل شيء سويته في حياتك. طيب والله حضرت اورثوبيديك كونفرنس، حضرت وبعدين نقول اورثوبيديك برضه ريليتد ها تمشي. بس جيت حضرت مثلا emergency medicine او حضرت internal medicine كونفرنس ما ادري فين في باريس ولا. طب انا ايش همني؟ طيب انا دائما مو شرط احط كل شيء، لا انا اسوي فلتريشن للاشياء اللي ريليتد للبلاستيك، هي اللي ابغى الاكزامينرز يبغوا يشوفوها. ايش الريسيرش اللي ريليتد للبلاستيك، ايش الكونفرنسز اللي ريليتد للبلاستيك، ايش الالكتيفز اللي ريليتد للبلاستيك. هذه اللي تبين لك، تبين للاكزامينرز انه او الانترفيورز انه انت فعلا انترستد في البلاستيك. لما تيجي تسوي له دايلوشن باشياء ما لها علاقه بالبلاستيك، هذا حيبين انك شخص عادي كاي شخص قدمت على كل شيء، ما عندك انترست، ما you're not focused. عرفت؟ حتى في الريفرنس ليتر بالنسبه للفيلوشيب لما اجي مثلا اقدم ريفرنس لتر واحده مذكور فيها انه انا interested in hand، وواحده والله interested in craniofacial، هذه حتبين للكوميتي انه انا صراحه not focused I'm not determined. لازم لا I focus خلاص، والله hand خلاص اخلي الريفرنس حقتي كلها hand، والله craniofacial لا اخلي الريفرنسز كلها craniofacial. و the same thing applies to residency for residency training. ما اجي اجيب ريفرنس من اي ار، والله ريفرنس من internal medicine consultant، ريفرنس من اي ان تي، ريفرنس وبعدين اجي لا، هذا تراي نخلي كل الريفرنس حقتي بلاستيك. او مثلا هاند قول اورثو هاند ممكن، اي ان تي برضه تمشي بس يعني افضل لو كانت بلاستيك. فهذا اللي يميز applicant من applicant.
يعطيك العافية دكتور. بقية الكويستشنز إن شاء الله راح نجاوبها بعد ما تنتهي دكتورة طيف من الحديث. دكتور فهد الجندان. In Plastic Surgery and Trust Club, we want to take a moment to express our heartfelt thanks for your insightful responses and valuable contributions today. Your wealth of experience and expertise as the Plastic Surgery Program Director has undoubtedly provided our audience with a wealth of knowledge on the intricacies of the interview process.
Thank you
Thank you.
very much, Dr. Malik, and I'm honored صراحة and happy to be with you guys. I hope that I added something today. وأتمنى منكم كلكم صح أنا ما كملت آخر سلايد. دقيقة كمل السلايد الأخير. أيوه هذا آخر سلايد. You can reach me at any time. وهذا خليني أكبر الشاشة. طيب my email fjindan@yahoo.com وماي تويتر account ممكن ترسلوا لي على الخاص @surgeplastics. Feel free to ask me anything at any time وإن شاء الله we'll see you كلكم إن شاء الله ناجحين وبلاستيك surgeons إذا كانت لها خير لكم إن شاء الله.
Thank you, Doctor. Again, joining Dr. Al-Jindan is Dr. Taif Al-Jaidi, a plastic and reconstructive surgery resident at King Fahd Medical City, second cluster in Riyadh, Saudi Arabia. A graduate of Imam Mohammed bin Saud Islamic University, Dr. Al-Jaidi will share personal insight, challenges faced during interviews, and advices for resident and young professionals aspiring to excel in their medical careers. Dr. Taif, welcome.
Thank you so much, Dr. Abdul Malik. Can we just take like 5 minutes prayer break and come back? إيش رأيكم؟
Yes, this will be better. عشان حتى
خلاص.
الصلاة
إيه بريك صلاة ونرجع. تمام.
ممكن.
طيب السلام عليكم. Can we start, دكتور عبد الملك?
عليكم السلام. Yes, sure. تفضلي
آه،
دكتور.
تمام، الله يسعدك. طيب, initially, thank you so much, Dr. Abdul Malik, for moderating this talk. I'd like to thank the Plastic Surgery Interest Club for this invitation. It's such an honor to be talking about my humble experience and to share some tips that would help other interns and service residents to ace the residency interviews. Also, I'd like to thank Dr. Fahad for taking the time to present today, and we really appreciate his efforts. طيب, we hope all of the attendees get the utmost benefit of today's talk. So without further ado, let's get started, inshallah. طيب, initially, when we want to talk about interviews, it's very important to understand the basics of interviews. So what are the things that you would be graded upon? What are the components of an interview? What are the commonly asked questions? How do I answer them in a very smart way? What are they expecting from me as an interviewee? So it's very, very important to understand these important aspects. So first, whenever you're going to an interview, you need to understand that there's a scoring system. There are certain percentages disseminated for each and every entity that I've mentioned here. Obviously, this differs from one center to another. I've asked multiple program directors, and the percentage also differs from one center to another, but generally these are the entities. So we have a certain percentage for GPA, we have a certain percentage for your assembly score, your communication skills, personality, and attitude, which would be clear as you both go with the interview and by answering the questions. There's a certain percentage for knowledge. There is a certain percentage for your English language and fluency, your CV, research, plus or minus your interest in the center and whether you were recommended by residents. So before going to an interview, you obviously have to prepare very, very well for the interview. So if I'm going to give everyone a single advice, it's going to be prepare, prepare, and prepare. And by prepare, I mean you have to list the commonly asked questions and you have to personalize your own answers. And I will explain exactly how to do that. The most important thing, though, is to not memorize your answer. It's nice to have preformed and prepared answers, just in case you get, for example, stressed out during the interview, something happened before the interview, you weren't 100% focused, you would still have some answers in your mind, instead of just talking out of nowhere. But also it's important not to recite your answers. So they don't want someone who's just reciting the answers that they've prepared before. I would advise everyone to do two files. One is what I like to call CV elaboration file, and the other is the commonly asked question file. I will show you my personal files, and you guys can take a look at them. And also it's important to understand the natural flow of the interview. How are they going to ask me the questions? What is the first question? How do we end an interview? What are the questions in between, and etc. So these two booklets are very important. This booklet is by Dr. Fahad Al-Gwez. He's an R2 ophthalmology resident. And this is by Dr. Ahmed Bahlal, who's an R2 ophthalmology resident and R4 plastic surgery resident. What I did exactly is that I took all of the questions that they have mentioned in both booklets, and I've created my own, and I personalized my own question. And why am I emphasizing on personalizing questions? Because these two booklets are literally in the hands of all the other interns and all the other candidates. So you don't want to be saying the same exact answer as all the other interns. So it's nice to have your own personal touch. Let me show you guys my own folders. Okay. This is an example of the This is an example of the Q&A question that I've created for myself. طيب, introduce yourself. Why did you choose this specialty? What do you know about our center's program? And as you can see, I've divided the programs into the programs that have a trauma and burn center without trauma and a burn unit, and then the programs with a research unit. طيب, you can do your own. Just create, put the questions and mention the answers and prepare them. This is what I mean by the CV elaboration file. So what I did is that I mentioned each and every conference, each and every award I've gained and I've written in my CV, and I elaborated when was it, what were, for example, who was presenting if it was a conference, who was the moderator at the time, what was my time, what was my role in the conference. This is very important just to keep track of everything, because sometimes one of the interviewers could be someone who presented or someone who moderated the session. So they would ask you who was there, what were the topics, what was the thing you, what did you learn from the conference itself? And very simply, you can say that I attended, for example, to meet experts in the field, to make connections. I really did not get most of what was being said or the topics presented because I think it's beyond my level, but it was nice meeting, making connections, conducting, starting new research projects with different candidates and interested and aspiring مثلا plastic surgeons and etc. So it's important to know when was the, for example, conference conducted, where was it conducted, who was the organizer, were there any sponsors? For me, I think it made everything easier and more organized. You can also do this for the research projects. It's very important to know your research from inside out. You need to know everything about your research. You need to know who were the authors, when was it published, what is the type of study, some like brief, you have to know briefly about your research. What was the methodology? What was the limitation? Because I personally got asked about one research project. They asked me about what was the conclusion, what was the limitation, who were the authors. So if you're not really confident about that certain research project, don't put it in the CV, because keep in mind, you will be asked about every single, you may be asked about every single topic or every single point you add in your CV. So it's very important to be aware of everything. So this is an example of, so I did this for every single research I've conducted. And some of the researches you can omit if you're not really confident. You can just, if you weren't really involved in the research project, don't add it in the CV. Trust me, it's going to give a very, it's going to be a red flag if you added a research that you weren't involved in. Okay, so to understand the interview's natural flow, so you can be mentally prepared, as Dr. Fahd Jiddan mentioned, first, they will be asking you personal questions. They will ask you questions about the center and the program. They will ask you CV-related questions, knowledge questions. In some of the centers, honestly, I was interviewed by a total of 6 centers. Only maybe one center asked me about knowledge questions. Attitude and ethical questions are very, very, very important. Some people do actually get rejected because of this section. And then finally, closing questions and any questions for the interviewers. And I'm gonna give you an example of each. So, interview day. It's very important to attend on time. I would advise you try to make yourself familiar with the location of the interview at least one day ahead, just to know where is it being conducted. You can go there anytime before the interview to see where is it conducted, ask other residents, just to be safe and make sure that you don't be late, because sometimes you do actually have 2 interviews on the same day. So we personally had 2 days with 4 interviews. So 2 on one day and then 2 on the other day. So it's very important to be aware of the location. Formal wear and professional attire, as Dr. Fahd Jiddan mentioned. I would say that ثوب شماغ for males or a suit for males. Females, you can either wear a abaya, or you can wear, for example, a lab coat with a pantsuit underneath, or something professional, but not scrubs. Again, print your CV and certificates. I personally did a portfolio, and what that is exactly is I printed my CV, and then I printed all of the certificates that I have and all of the awards. And I've sectioned out the portfolio, and I made like 5 copies of each. You can carry it with a briefcase or with a pouch or whatever makes you comfortable. And surprisingly, they all asked about it, and they were happy that we had portfolios. So it's important to do that. Again, the most important thing just to keep in mind is always stay focused and precise. Only answer the questions that only answer to the extent of the question that you're asked. Don't open don't allow for any new doors to be opened, because trust me, it's better to only answer to the extent of the question. Okay, general tips. This is a very important tip. The time spent in the interview means nothing. Meaning you can have an interview that lasts for 2 minutes or even 5 minutes, and another interview that lasts for 30 minutes. This does not mean that the interview that was 30 minutes, they're interested in you as a candidate, and the one that was 2 minutes, they do not want you as a candidate. So this is important to keep in mind, just to reduce the stress. And some of them could be already, some of the interviewers do this or don't spend very little time interviewing you because they know you, or they went through your CV in a more they looked into your CV in depth, I could say. So they just wanted to hear certain things. So it's fine. That does not mean that they're going to reject you because they spent only 2 minutes interviewing you. Again, always greet the interviewers and maintain eye contact. Maintaining eye contact is very important, but sometimes it could be difficult when you have a lot of interviewers in one session. For example, in one of the centers, we were interviewed by 9 interviewers. We're in the same room, and you were on the other side of the table. So it's very difficult to distribute eye contact in this case, but try as much as you can. Again, as Dr. Fahad mentioned, never ever lie. No matter how much you want to impress the interviewers, do not lie, because they will know you are lying, and that is a red flag. Their questions are meant to bother you. They do ask these questions deliberately just to bother you. Again, think twice before answering. Stay calm, take a deep breath, and answer in a very professional way. Again, you have to be very confident when answering the questions. Okay, let's take one part at a time. So in these 5, in the personal questions section, these 5 questions are very, very high yield. You will be asked on these questions. So you have to prepare for them very well. So if you don't want to prepare any question for the interview, make sure that these 5 at least are prepared and you have personalized answers for them. Introduce yourself. And in this question in particular, please don't take more than 1 minute. All of the questions should be answered in less than a minute. Or in the introduce yourself question, you can take 1 minute, but not more than that. So what they want to hear is your name, where you graduated from, mentioning your GPA and whether you were on the dean's list is controversial, so it's up to you. If you want to say it, say it. If you don't, it's fine. Mention very briefly why you are interested in this specialty. And then finally, something that makes you stand out. For example, let's say a hobby or something that is not found in any other candidate. So by this, you would conduct a very precise and yet perfect answer. So an example of this, خليني أعطيكم one example. مثلا, first you thank them. So thank you for taking the time to interview me. My name is مثلا طيف فواز الجيدي. I'm a medical intern, graduated from Imam Muhammad with a GPA of blank. مثلا I was on the dean's list. It was my pleasure to be on the dean's list this year. I'm vastly interested in plastic surgery. I took a total of 6 rotations in my internship and as summer elective training. I devote my free time to, let's say, horseback riding and running. That's it. That's all they need to hear. So this is the most important question. Next comes why you chose medicine, why you chose plastic. This is highly personal, I would say. You have to have your own personalized answer for this and make it, again, very precise and realistic. Okay, do not fake stories, please, because I've heard some candidates, they faked stories about being inspired by a certain surgeon, and then that wasn't good. It did not end up good. So do not fake any stories, please. Strengths and weaknesses, easy. Say what is your strength, why would they choose you, what makes you stand out. In the weaknesses, it's very important not to mention red flags. So try to make it as a masked strength. For example, as Dr. Fahad mentioned, you can also say, مثلا, in weaknesses, you can say, for example, I focus too much on work. I obsess in performing my duties perfectly. And always mention a solution for your problem. So let's say you said, I focus too much on performing my work perfectly to a point that it could delay the overall process, but I'm learning to perform it adequately rather than perfectly because I've realized nothing is perfect. Sometimes I think about patients and their conditions at home when I'm trying to rest. So I've decided to do homework dissociation, etc. So these are not red flags. These are actually good things, but you can actually present them as if they're weaknesses and give solutions. So never mention a weakness without mentioning a solution and that you're working on it. Why would you choose you? Very, very, very important. The most important thing is that you don't sabotage other candidates. So you would say something like, مثلا, I have so much respect to all of the other candidates that are applying this year. I'm sure all of them are excellent and academically qualified since they match to this competitive specialty. As for me, I see myself, for example, a very meticulous person. I'm detail-oriented. I'm organized. I'm enthusiastic. I try to perform my best in all of the rotations, even though I'm not interested in that rotation. And hence I see myself as someone who's responsible and reliable. And you can say any other things, but this is just an example. So the most important thing is that you do not superiorize yourself on other candidates. Like center and program questions, they would ask you something about what do you know about our program, and that's why it's very important to do your research, as Dr. Fahad mentioned. تعرفون ايش الvalues, ايش الgoals, ايش الvision, do they have a trauma center, do they have a burn unit, is it part of the joint program, are they a separate program? This is very important. The people who will help you in this section are the R1s. R1s probably know all of the aforementioned questions, so try to ask them. They would ask you if you worked with any residents here. So if you did, just mention their names. Did you do a rotation in our center? This is a very important question. Or they could ask you also, why didn't you take a rotation with us? Please, please, please be honest. Do not lie. Okay. So for example, if Center A asked you, why didn't you take a rotation with us? Simply, if you really applied and you got rejected, you can say that. But if you didn't, you can say something like مثلا, the internship unit in our university is a bit strict about taking outside the rotations. We're kind of obligated to rotate in hostels B and C. So hence, I did not have the pleasure to rotate with you. لا تكذبون. هذا أهم شيء لأن there's one incident that happened where the candidate said that I applied and I got rejected. And they were like, who rejected you? What's the name of the person you contacted? And they figured out she was lying. So be careful of these things. Number 4 is why us? Again, so study center really well. And again, please do not sabotage other centers. Don't say, I want you because hostel B and C do not have this, and that. So only focus on the pros. or the advantages in that certain center that you're being asked upon. Do not mention other centers. And as I mentioned, trauma center, burn unit, and joint program or separate, mention them if they are present in the center that you're being interviewed in. Okay, CV related questions. As I mentioned before, you will be asked about every single point in your CV, or may be asked. And do not underestimate the hobbies section. Please, hobbies section is very, very, very important. Mention your true hobbies, because I had one of the interviews, they only asked about hobbies, surprisingly. So they didn't ask me about research, they didn't ask me about the awards, the conferences, they only asked about hobbies. So it's very important to keep that in mind. Knowledge questions. Okay, as Dr. Fahad mentioned, you can't say I don't know, simply. So one of the centers asked me about, I remember it was, I think, about a boxer's fracture. What is a boxer's fracture and how do you reduce it? So if you don't know, just say simply, I do not know. I will search about it, or simply, I don't know. Because you know what, like as an intern or as a service resident or at that certain level, you are, even as an R1 or R2, sometimes you're not even expected to have that much of knowledge, because knowledge, you will actually acquire the knowledge throughout the years. You have 6 years in front of you, inshallah. So knowledge is going to come by time. So the most important thing to focus on here is to say, I don't know if you don't know. Do not make up answers unless you're talking of a background or you've read it somewhere. But the most important thing is that you say, you focus on being a safe physician. So if you don't know, just say you don't know. Simple. Ethical questions. And the ethical questions, they only want to assess whether you respect hierarchy. This is number one. And number two is whether you know how to handle a difficult situation. So always focus on being respectful when answering the questions. This is the chain of command that you usually follow during the on-call and during your duty. So you have to know this before entering the interview. You have to know who's the second, who is usually the second on-call, who's usually the third on-call, to know who to contact if they gave you a scenario. And the most important thing here is to stay and be a safe physician. This is the most important thing. If they gave you an ethical scenario where, for example, I remember one scenario where they asked me that you were in the ER and you and the senior applied a cast for a fracture. And you thought that the cast was very tight on the patient. And the senior was very busy and she wanted to go to the OR, so she was telling you to discharge the patient. So what would you do here? So Hina, a very safe approach would be is that you would stop, you would talk to the senior very respectfully, and you think that the cast is tight, the patient may go into compartment syndrome. If but then they told me, okay, but the senior said, no, it's fine. You would either talk to her again, or you would escalate to the third on-call, and then you would talk to the program director. So you have to know the hierarchy and the chain of command. Okay. Closing questions and questions for them. This is very important. You have to be smart. The most important thing is do not ask about your performance during the interview. Never ever ask how did you do, or ask for feedback during the interview. You can do that afterwards, as Dr. Fahad mentioned, through an email or so, but not during the interview itself. Some questions you could ask, for instance, you can say, you can ask about fellowship opportunities, if they do sponsor candidates this year or not, if there are any teaching opportunities that you can offer as a resident for other residents, or for example, interns, and etc. But do not ask about your performance. I think that is about it. Yeah, so thank you so much for attending today. I hope you guys you enjoyed our topic. And if you have any questions, inshallah, I'll be more than happy to answer. Thank you so much.
يعطيك العافية دكتورة على وقتك وجهدك معنا اليوم. مرة ثانية في حال كان عندكم questions إن شاء الله الدكتورة طيف راح تجاوب الأسئلة. طيب دكتورة خلينا نبدأ بما أن الأسئلة شوية كثيرة.
Okay.
في سؤال كان يقول how do we respond if we are asked as to why don't we have a recommendation of reference letters or reference letter.
من السبيشالتي صح؟ قسم في the same specialty.
سواء بشكل عام يعني
Um,
recommendation or reference letters.
Okay, simply, usually they do not ask such a question, but simply you can say, I didn't have the opportunity to ask for one. مثلا the people I worked with, or for example, the consultant I worked with was a program director. So he told me that he usually does not provide references or recommendations just to prevent bias. Then I personally encountered this. One time I asked for a reference letter, but the consultant was a program director. They mentioned that as much as they wanted to give me a reference letter, they could not because of the bias. So you can try to find out or create a very smart question for such a very smart answer for such a question. But usually they do not ask such questions.
طيب دكتورة, which part of the CV are best to have in the first page?
البيسكس اللي هي مفروض your demographics, plus or minus your GPA, plus or minus your SMNE score, and then your affiliation, من وين تخرجت, and then أول شيء the first page should be the awards and honors, and then you can go there after. But
Nice.
this is usually how.
How to make the CV impressive?
First, you have to mention the things that make you stand out. For example, your awards, your honors, your elective rotations that you took, and try to make it oriented, specialty oriented. So let's say if you're someone who's interested in medicine, let's say, and plastic. This is not possible, but generally speaking, and you've done a lot of things in this field and a lot of things in the other field, try to make it oriented to the specialty that you will be interviewed in. For example, plastic. So only mention the conferences you attended in plastic surgery. The awards you can mention for both. Electives, only mention the electives that you took plastic surgery in. Because if you took an elective in another specialty, they will ask you, why did you do that? Are you still hesitant about this specialty? And so on and so forth. Another thing that will make the CV stand out is the references, in all honesty. If you have a lot of references and recommendations, I think that makes your CV stand out, in addition to research projects. So it's cumulative. It's everything, mentioning everything you did and giving each and every section حقه نقدر نقول. So تعطوا each and every section حقه وإن شاء الله بإذن الله it would be impressive.
بإذن الله. Is non-curriculum content favorable to be mentioned in the CV? I think دكتورة جاوبتنا بخصوص جانب الهوبيز. السؤال اللي بعده, if I get accepted in my second desire and my CV not well fit, do you recommend telling them it's my second desire?
No, do not mention أبدا and it's your second desire. Try to orient the CV as if it's your first desire, and be very confident to mention that don't say it's your first desire if you weren't asked about it, but generally do not tell them it's your second desire, because even though some of the program directors say they will now not down rank you, sometimes they do if you said this is your second desire, because compared to other candidates who are coming as this specialty being their first desire, obviously you're not going to be ranked in the same level, honestly.
Nice. How would you answer questions that would reflect negatively on you, such as why we shouldn't choose you?
نفس فكرة weakness. Same concept. and don't give them red flags, or try to mask it, try to make it as a masked strength. نفس الexample حق الweakness, I would say.
جميل. زين دكتورة, how can I take rotation in plastic surgery?
كيف؟
Abdulaziz asking, how can I take rotation in plastic surgery?
Okay, so it depends whether you're a student or an intern. For the kind student, you talk to the to your university to issue a letter, and then apply. So it depends on in the hostel you're applying on. For example, King Faisal Specialist Hostel usually open their applications online, so you have to go in online and submit your application. Other centers, you have to contact the secretary via email. So it really differs from one center to another. If you are an intern, usually the internship unit applies for you. You just have to give them a heads up about the rotation and when do you want it. So it depends on the center itself. But most of them, it's through email. Most of them, up to my knowledge.
Nice. Another question. I am a service resident and I have been asked, what did you match last year? Suppose I nominated plastic last year, but I didn't match. How can I handle these situations in front of the interviewer? Thanks.
Okay, that's a very nice question. Okay, so first you would say that that compared to last year, for instance, you've worked on multiple researches, you've enhanced your CV. Let's say you took a service, you took a service job in Hostel A, for example, and you came back this year with a stronger CV and hopefully with a stronger opportunity of matching. The most important thing here is to not take the question personal. Usually they ask these questions just to, let's say, sometimes irritate you or to see how you handle such questions. But it's fine if you did not mention the first year. You worked. The most important thing is to show them that you've enhanced and worked on your CV to improve your chances of matching. That's it. That's all you need to say. So whether it's research, whether it's elective rotations, whether it's working with surgeons in the field, attending conferences, all of these will show that you've actually made an effort to improve your CV.
Nice. Abdulaziz is asking also, how to increase the chance to be a plastic surgeon?
How to increase the chance through maintaining a high cumulative GPA, scoring high in SMLE, conducting multiple researches in the field, conducting a CV that well represents you and your achievements, and hopefully, inshallah, bidnillah, you will match.
Last questions from the audience. What if I have no awards or honors? What should I do?
Fine. It's fine. So it's important to understand that not everyone is good in every single section of the CV. Maybe you don't have awards and honors, but you took several electives, or you conducted several researches, or you attended multiple conferences. For example, for a person who, let's say, did a lot of researches, does not have, for example, a very high GPA or a very high SMLE score. So not everyone is perfect in every single section. Just make sure that you try to excel in as much sections as you can. This is like my advice. But it's fine if you don't have awards and honors. It's more than okay.
There are two more questions. ايش الكتب اللي تخص لغة الجسد؟
هذا أتوقع من دكتور فهد. I think he mentioned something about body language books he will be sharing, inshallah.
Okay. What if I had to take 1 year off due to certain circumstances and I couldn't enhance my CV? Will I be asked about it? How do I answer?
Yeah, if you took a year off, yes, you will be asked about what did you do. But simply, if you had certain circumstances at the time, you can tell them that you couldn't enhance the CV due to these certain circumstances, but you are planning, inshallah, on improving your CV thereafter. So, but if you took a year off, yes, you will be probably asked about it. So just prepare a very smart answer. Even if you did not enhance your CV at the time, mention that you will be trying to enhance your CV يعني in the upcoming weeks or months or so. But you have to find a solution. You have to mention a solution for the problem.
برضو دكتورة في سؤال يقول can I answer talk about yourself questions in 5 minutes?
لا, that's very that's too much. You know, one of the centers when I was being interviewed, عشان أقول لكم how serious it was, the interviewer had a timer on the table. For each and every question, they would reset the timer. And the timer was, I think, one minute. If I try to practice as if you're going to answer the question in less than a minute. 5 minutes, no one's gonna listen for 5 minutes. They will be moving on to other questions, and you will lose your opportunity of answering more questions. فانتبهوا.
Yeah, sure. Do they ask about the transcript?
Do they ask about the transcript of what exactly? Transcript of إيش?
I don't know, but maybe اللي هو الcertificate or الGPA.
Yes, هذه من ضمن sometimes they ask you to add it in the portfolio. I think 2 centers told us to print it. Yes, the academic transcript, yes.
Nice. Another one, can high GPA make out for non-published research in plastic or no elective during medical school?
Okay, so if I'm being honest, you have to keep in mind that all of the candidates have a high GPA. طيب. So especially if you're going for a competitive specialty, usually all of you have a very high GPA. So try as much as you can to conduct research and take electives. Maybe if you're currently an intern, it's a bit difficult because the matching system and everything is coming up. But at least you should have research, and you can put it as ongoing on the CV. It doesn't have to be published, but at least that you're working on something now. Because keep in mind, everyone has a high GPA, so you will not really stand out from that aspect.
I think we answered all the questions in the chat. Dr. Taif Njedi, we are in Plastic Surgery Interest Club. We want to extend our sincere appreciation for your valuable insight and personal experiences shared with us today. Your journey as a plastic surgery resident offers a unique perspective on navigating the interview process. So we want to thank you, Dr. Taif.
Thank you so much, Dr. Abdul Malik, and thank you everyone for attending. I hope everyone enjoyed the talk, and if you have any question, please don't hesitate to contact me or anyone in the Plastic Surgery Interest Club. Thank you so much, and have a great rest of the evening.